Hey, welcome back. It's no more news that the world is experiencing the second wave of COVID-19. Of course, it's getting more serious in some countries that the second round or third round or fourth round of lockdown is presently going on, and every reasonable government is actually putting in place protocols that will effectively, before the general vaccine spreads across the globe, so to say. And Nigeria is part of the world, and so we are also worried as in recent days it has kept increasing, going by what the PTF normally reel out daily about the issue of COVID-19. And so right now we want to look at dealing with the new wave of COVID-19, and the guest is no other person than the Honorable Commissioner here in Ogun State, Dr. Tomi. Dr. Tomi, you're welcome to the program.
Good morning, and thank you for inviting me to the program.
Yeah. You're welcome. Dr. Kuka, let's go straight to the question, because the issue at hand is a health issue, a national issue. At what point did the federal government say to you that we are at the second wave? Was it because the other countries are in the second wave? That is why you are in the second wave.
Well, thank you for that question. What we know, as your colleague said, is Nigeria is part of the globe, it's part of the world, and we've been observing the last sort of month or so, 4 weeks, the second wave in other countries. But if you look at the trend, the numbers reported, around October, we actually hit a low. And then recently, in the last few weeks, the numbers are starting to escalate. And in particular in Ogun State, before around October, November, we would be getting, even beginning of December, we'll be getting 2 positive tests a day, maybe 5. But in the last 1 week, we've been getting 13, 12. Although Ogun State has it contained and controlled, relatively, there's an upsurge of the cases, new cases now. So that's why it's been, decided by the federal government that there is a second wave. In Lagos, the positivity rate was 13%, and even when I spoke to my colleague there recently, he said 7%. In Ogun State, where we were experiencing 0.7%, but at some point we got to 2%. So if you look at the positivity rate, that is what helps you decide that, okay, we seem to be going up again. So it is real. The second wave is here.
Now, as far as Nigeria is concerned, you are an insider. Just like you said, you spoke to your colleague in Lagos, you actually mingle with people regularly, that is government at the federal and the state. What do you think could be the cause of Nigeria that we are going through, that we are trying to nip in the bud?
I would say it's multifactorial. It would be, number one, there are non-pharmaceutical interventions that they've told us to actually observe, such as wearing your mask and making sure you're 2 meters away from people, washing your hands, and also not gathering. We as Nigerians, we've actually all flaunted all those rules. In the last 2 months, people have started having parties, gathering, the religious gatherings of over 1 million, 5 million that have happened in the last 2-3 weeks, even within the state. Those are crucibles where you could spread the virus. So that's one factor. There's another factor that this is the festive period. A lot of Nigerians in the diaspora are probably coming home for Christmas. And this, we do know that the outbreak in America and England is a lot more than we have in Africa. So there is a possibility, it's not been proven, until we start seeing the same variant that they carry in England and America. If we start seeing them in our community, then we can say categorically and objectively that that is the reason. But there is a potential that that's the reason that. So those 2 factors would be probably why we're having the second wave.
Okay, looking at the second wave and the percentage, it is increasing now. Is there any cause for alarm? Do we need to panic, or do we need to get ready to be locked down again?
I wouldn't say there's a need to panic. What I would say is there's a need to sit up and pay attention, and actually, if we are going to avoid a second lockdown, we all have to take personal responsibility now. It would be a shame if we have to lock down, because the economists have shown that dip in the economy, and if there's what you call a W dip, then the recovery is going to take 10 years. The recession, we're already in a recession. So if we all want to preserve our livelihood, we all have to sit up and all the non-pharmacological interventions, your mask, washing of hands, social distancing, just as we did at the beginning of the disease when we didn't understand it, we were more observant of these directives. Also, no gatherings. We will be having restrictions without any doubt. His Excellency, the President of Nigeria, Muhammadu Buhari, has actually put down, they've laid out, the federal government laid out the restrictions that we have to observe now, not more than 50 people. If you have to have a religious gathering that's more than 50 people, it has to be outside. Schools are closed till the 18th of January. Markets open, but also with the restrictions of wearing your mask, washing your hands, social distancing, hand washing facilities outside markets. Bars, restaurants are closed. So there are restrictions coming in, and vehicles have to be less than 50% capacity. Churches have to be less than 50% capacity. You're not really, you should avoid any travel that is non-essential. So all these things, the federal government has put them out about 48 hours ago, and we are part of the nation, so we have to observe it as well in Ogun State.
Okay, one of the major headlines in today's paper is that the federal government is pushing hard for COVID-19 vaccine. As a stakeholder, can you throw more light on this? What is the situation like?
Okay.
Where do we stand?
Well, the vaccine, as you know, was sponsored. Other countries invested in the vaccine, so they had the first access to it. But we're lucky as because we're part of the COVAX coalition, which are, a group of countries that developing countries have come together to put money together and say, okay, we're going to buy some of the vaccine as well. And we also have Gavi Alliance, Gavi Vaccine Alliance, which has procured about $1 billion, from what I understand, vaccines for low socioeconomic countries. And the thing is, there's the saying that to get rid of COVID in one place, you have to get rid of it everywhere. So globally, no country is going to be left behind. It just depends how soon it comes to us. It's not with us now, but I'm sure by the first quarter of the year, we will be getting some dose, not necessarily enough to go around everyone, because the ones available now, we don't really have the logistics to distribute it, which is the Pfizer one, because you need a minus 70 degrees Celsius refrigerator, which we don't have. What we would be hoping to do as a nation is to ride on the logistics of the polio vaccine, which we already have, because polio is eradicated now. So we can use all the, the cold rooms that we use for the polio vaccine. So I believe that's probably the way we would be going in Nigeria.
Okay, let's look at the first wave that we overcame, in quotes. And
we contained.
We contained. That's why I said in quotes.
Yeah, we contained it.
Can't we use the guidelines we used for the first wave, for the second wave, so that we won't experience what we experienced during the first wave?
We're using exactly the same guideline. There's no change in the guideline. The only slight difference from the first one is the economic impact, the decisions about the markets, because we know people have to go to markets, get fed, so they haven't shut the markets, but every other thing is shut, and they haven't shut interstate travel because it's the festive period. But really, our advice would be, if you don't need to travel, don't travel. Stay where you are, because you actually, like for instance in Ogun State, 70% of our citizens actually live rural. and there's 30% of us in the urban area. The people in urban area, I'll urge them to stay in the urban area, because the reason we've been able to contain this virus is in the rural area, they are, sort of protected because they're outdoor and the interaction is less. If we in the urban area are now moving into the rural area, then we spread the virus even further, then I don't know what we'll be facing at that time.
Okay, let's come back to Ogun State. Federal government says level 12 and below should be working from home. Lagos State government says level 14 downward should be working from home. I know that decisions, let's take Lagos State for example, we're close to them, could be different from Ogun State, but from what is on ground, what is likely to happen in Ogun State, because I know you will be the head of the team that will give advice to Mr. Governor before it comes out with a pronouncement. Where are we likely to head in Ogun State, looking at the issue at hand?
I guess we have the federal guidelines. The minimum will be to follow the federal guidelines. His Excellency, I hope, I know, should be addressing us soon in the next, 24 to 48 hours on what his directives would be for Ogun State specifically.
But for people, it's a Yuletide season, it's a Christmas period. People thought the festivities we've had in the past, when we were really in the midst of the coronavirus and looking at the softness we have enjoyed recently until the second wave is becoming a reality. But realistically, what will you tell the people as they prepare for Christmas? You know Nigerians, you know celebrations. How we do when it comes to celebration. And this is Christmas, quickly followed by New Year.
I would strongly advise every citizen of Ogun State that, if possible, we should limit the number involved in our celebration. Stick to your family. You could have a good celebration with just your nuclear family or a little bit of extended family. For instance, in England, let's say maybe 3 families could meet maximum. And we should no festivals, no carnivals, no street parties. Event centers should be closed. Nigerians should please, I know there's watch night service. I love to go to watch night service. But during the COVID, we were able to even worship from home. So I'll encourage all of us to stay at home and do our watch night crossover service, Christmas service at home. Our church, our religion is in our heart. It's not in a place. Even the Bible tells us that we are the church, not the building. So we have to bear this in mind, because it's only the person that actually survives till the next year that can worship God. If we're exposed if you're ill, you can't worship God. So you have to take a personal responsibility to ensure that we are not the spreader and we're abiding with the rules and regulations, the restrictions that they've placed upon us.
Okay, before Charity comes in, let me quickly ask this question. After a long break, the students came back to school. We had staggered system in Ogun State, but private schools were able, because of the number we could understand. But all through, was there any major concern as far as COVID-19 is concerned in Ogun State from the students?
We had an opportunity to screen a few of the primary, secondary school children when they returned. The positivity rate in them was not alarming.
Okay.
But you have another group, which is the tertiary group, and they are usually the higher carriers. And but Ogun State is not typical, if you really look at it, of what is happening in like FCT, Kano, and Lagos. We're not typical. But we didn't see any alarming rate, and even in that age group, which would be, between, the teenagers to early 20s, they are asymptomatic, and that is the danger. Because right now, with festivities, we'll be going back to our grandmothers, grandfathers that have underlying conditions. So we have to really think carefully. Do we really need to make that journey? Because your teenager could be asymptomatic, and you then go in and infect your parents that are they've got high blood pressure, diabetes, and we know for certain that the group of people that actually succumb to this disease, the commonest thing is hypertension. And being over the age of 60, the federal government has actually said that anybody above 60 should refrain from actually going anywhere, to stay at home. Don't go to church. Do your church online. Don't go to the market. Find someone else to do the buying for you. It's very important that we actually adhere to this.
Ma, let's analyze your workings, your activities during the first wave in Ogun State especially. Can you tell us, do people really believe there's COVID-19? Because we hear some people still say it is just science, and it is not really real. In Nigeria, they are trying to use COVID-19 to scare people. Is it true?
Unfortunately, that is the case for majority of people. They think it's a money-spinning venture. Yes, that's a venture, So, and it's not. I personally, in my immediate family, I've seen, cousins die of COVID, both here in Nigeria and in England. So I've seen people being ill with it. So it is real, and we have to take it that, that we know of people who have died, and it's not a disease of the rich, as some people purport. It's actually anybody. I look after people. There are lots of people that we have looked after in Olabisi Onabanjo. In Ogun State alone itself, we've had 2,320 odd people test positive. We've actually lost 35 people, 35 too many people that shouldn't die if we all adhere to what we've been prescribed. And we continue to test. We've tested 45,000 citizens of Ogun State, and even in between the festive periods, we'll continue to test. So you'll find responders in all 20 LGAs during the festive period, providing the opportunity to actually get tested. So please, we do have phone numbers that we've circulated for every local government. I'll give that number to you that you can publish. Every local government has a group of people, the responders, that can go out, test them, or if you have any concern that you feel unwell, you want us to come, the number that we've always used is the 0800 123 567. That's the emergency toll-free line that anybody can call during this season if they have any concern, and our epidemiologists will pick it up.
All right, it's a health issue. We are trying to actually do our own bits to prevent the second wave of COVID-19, which incidentally is real all over the world. And Nigeria, it's part of the world. Ogun State is also part of the world. That's why the health commissioner is. So, if you have any question, our lines are going to be opened. The line is open already. Let's have the number on the screen so that people can call, just ask your question, and of course, let's see if you can get enlightened the more, so that we'll all together fight this scourge, so to say. It's a war, and it's not averting yet. Dr. Tomi, how bubbling, or how, let me say, how busy are the test centers that we have in Ogun State?
Right. Currently, we are running about 700 tests minimum a day. Samples. We get samples from all 20 local governments, minimum of 700, and we are churning out at least between sort of 400 to 500 results on a daily basis.
Let's take this call, Dr. Tomi Kokorada. Hello.
Hello, good morning.
Yeah, good morning. Your name?
I'm in calling for the doctor.
Yeah, the health commissioner is here. We're looking at dealing with the second wave.
Firstly, I want to compliment the commissioner.
Good morning.
For my friends who are testing, she's doing very good and active.
Thank you very much.
She makes me remember the life of the Maya commissioner, that's very good at that. Let's try to comment that.
Thank
All
you.
right,
Thank you, sir.
Thank you for that call.
Okay. Thank you. Just want to commend the commissioner. Do we have any call? Okay, let's allow. You were about. Okay, there's another call. Let's take this call. Hello. Hello. Good morning. All right. Let's see. We can't. Okay. Let's allow Dr. Tomi to. You were about completing that question when that call came in. Yeah. Go ahead.
So we have two testing centers, one in Abeokuta and one in Shagama, the Olabisi Onabanjo University Teaching Hospital. And between them, they have a capacity of testing 450 tests straight. But we also use a device that helps increase our capacity, which is what you call pooling, where you pool tests together so that 1,000, I can actually pull the test and do 1,000. So that so we have the capacity. It's busy. It continues to be busy.
Okay.
And because we're out in every local government, so and we're moving around. We're not static. So we'll move from ward to ward to ensure that we capture people.
It's continuing to be busy, even though we pray that in a not too distant future, it will not be busy at all. Let's take this call. Hello.
Hello, good morning.
Good morning. Your name?
Hello?
We can hear you. Your name? Where are you calling from?
Okay, this is Pastor Lukimen from Jebu Itele.
Okay, go ahead with your question or observation.
My question to the commissioner is on the COVID-19. I think so far the students are now in holiday. They should try as much as possible to make a proper arrangement for these children. Because by saying that the school should go one thing or the other, and you don't allow the school to collect any money from the children. So, as part of our educational obligation, the state government should try as much as possible to see to the betterment of these children, because they are the future tomorrow. Thank you.
I think anyway. Let me. I'm not your mouthpiece. You heard him.
Thank you very much. I am not the Commissioner of Education, but Ogun State actually was one of the states that, it was the first state to actually provide DigiClass for the students, which meant that children could do their schoolwork on TV, and they also staggered it, that they could, actually access it in the morning or in the evening. The government is making all its efforts to ensure that our children are kept occupied, engaged during the time at home. We'll continue to try as an administration.
Okay. Hello. Turn down the volume of that TV set. You know the rules now. If you want to be part of the program, turn down the volume of your TV set. It's been on for nearly all stations, radio or TV. Do say this. So you should be part of us by now. Let's take this call. Hello. Good morning. Your name again? Okay, you're welcome.
Holly.
Yeah.
Thank you very much.
Good luck. Okay. Okay. Thank you very much.
Thank you.
All right.
I need all the prayers.
You need all the prayers now.
Yes.
No doubt about it. Because especially, it was like while you people came on board, I'm talking about all the health commissioners. It was like the COVID came to face your
Looking for
ministry.
us. But it's been an opportunity
okay.
rather than a challenge. I think.
Hello.
Hello?
Yeah, good morning.
Yeah, good morning.
Your name?
Yeah, Engineer Timothy from Bayelsa.
From Bayelsa. Yeah, it's good to have you all the way from the Bayelsa. Go ahead.
Yeah, I know that federal government is planning to open the border. So I want to ask, about this COVID-19, what is the state doing about it? Erica.
What is Ogun State doing about?
Hello.
Yeah, so what is the state government doing about causing the entrance of
Okay.
immigrants into the state because of the COVID-19?
Thank you very much for that question. Even when the border was shut in the first wave, we had Nigerian citizens coming across to the Idiroko border, and we had to work with the port health and authority, and we continue to work with them. We are very, very conversant with the fact that there will be a challenge. I don't know if His Excellency will change his decision to open the border by the 31st of December. I think we just have to watch the space and see what would happen.
I was going to say that too, that maybe that decision came before
the second
we started seeing the red light again. And of course, there's nothing wrong. There's no shame in looking at this present situation and say, okay, for now, let's tarry a while. It's just normal. Okay.
I want to ask about the walk-in test centers again.
Okay.
I know that the state government has small centers that you can just walk in, going for tests, and your samples will be collected and taken to the major centers. Do we still have them working?
We have stopped the walk-in centers. What we now have is, as I said, we've decentralized. To every local government has a group. They have a number. You could call them and they'll tell you where they are, and you can actually go and have your test. So it's a walk-in, but it's not a static walk-in sampling center. So they are within your local government, within your reach. What we found is people having to travel from one end of a local government to a static sampling center was becoming challenging, and our yield became lower. It dropped because we had sampled all the people in that vicinity. So what we did was now decide to move from one ward to the other. So if you call the number, which I'm going to provide you, you can easily go and get tested.
Okay, before we get the numbers, let me ask this layman questions that we hear people talk about on the street. Thank God you are a doctor and you are the health commissioner. Can a treated patient, discharged, recontract COVID-19? Or is that something that will make the person immune from the treatment he or she has gone through?
That's the million-dollar question that the researchers are trying to answer, and it is a real question. I'm not making any joke of it, because we're still studying the people who have contracted the disease, recovered, because when you actually come in contact with the virus, you develop what you call antibodies, IgG and IgM. IgM is the short-term one. IgG is the one that protects you in most diseases for life. But because this disease has only been with us 12 months, we don't know that if the immunity conferred on you actually lasts a lifetime or it only lasts a few months. For instance, another coronavirus is the common cold, the flu. And the immunity that you get from the common cold is only short-lived. You can get it again. So we don't know if this is the way that coronavirus would behave. I remember there is one incident in America that they said someone who had it before got it again, but that's the only one I know of. So they are studying people who have had it and looking out that do they actually have a recurrence. And I'm sure with time we'll find out if that
the numbers.
But none yet in Nigeria.
Not that I know of.
Yeah.
The numbers are 20 numbers.
Okay.
So I'm going to, the 20, each local government has their own
so
number.
we'll
So we'll give it and you can post it. Yeah, so I can't have that anymore.
All right. We allow you go. Once again, corona or no corona, we thank God that we are alive.
Absolutely.
So Christmas is here. What's your Christmas message to people there?
So I'm going to wish you all a Merry Christmas, but I'm going to also charge you that we should celebrate responsibly and ensure that we stay safe and stay out of harm. All the best.
Thank you.
Thank you very much.
Dr.
Tomi, the Commissioner for Health in Ogun State, and together we've been looking at dealing with the new wave of COVID-19, and we also want to thank those who were able to call in. Remember, together we can fight and win this war, but it is together. Not that government will be doing their own and we will not be actually following the instructions by following COVID-19 protocols. It's only when we work hand in hand, hand in gloves, together that we can actually survive this, and I know that we will survive. Thank you very much for coming to the program.
Thank you.
Thank you for having me. Very good.